Story 1. My husband had been sick and was undergoing many tests, including X-rays and MRIs. We received a call from a doctor on December 24th stating that the test results were much worse than anticipated. However, the doctor suggested discussing it further after the holidays and wished us a Merry Christmas. Story 2. Nurse practitioner. Why did you get tattoos? How will you get a job? Me. I have a job. Nurse practitioner. Okay. Well, have you considered how you'll look on your wedding day? Me. Sorry. Are you going to prescribe antibiotics for my ear infection? Story 3. A dentist told me at the age of 12 that my teeth were so bad I would never be able to get a job if I did not get braces. We could not afford braces. Took me years to smile with my mouth open again. My teeth were fine, and I have actually had people comment on how they look nice. I have canine teeth that resemble vampire fangs, but I like them. I am a neuroendocrine researcher and teach genetics in college. They didn't care about my teeth but my abilities, unsurprisingly. Story 4. I guess I've been lucky. My doctor merely wrote on my chart that my appearance was well-fed and pleasant. If I ever write a memoir, that will be the title. Thank you all for giving my little comment so much attention and for sharing similar fun stories. I've never opened my feed to find so many notifications. I did my best to respond to each of you individually as I enjoyed a cream-filled almond croissant before watching Tina Fey and Amy Poehler, two hilariously talented people, perform live on the Restless Leg Tour. While I read your messages, I may have missed responding to a few. It got a bit overwhelming there for a moment. I sincerely hope that we all learn to look for the humor in our situations. I promise you it's always there, even if you have to dig a little. Story 5. I requested pain medication after a root canal and was labeled an overly emotional woman by the dental surgeon. Story 6. Your symptoms are not severe enough to refer you to therapy. I was lying in bed and having suicidal thoughts. I asked them how serious they wanted me to make it. Not my proudest moment, but I remember thinking, what kind of message does that send to a person desperate for help who is having dark thoughts? Story 7. I had persistent acid reflux to the point that my teeth were getting damaged. The doctor insisted that if I just lost a little weight, everything would be fine and that I needed to be more active. Mind you, I was at my lowest weight at the time and quite healthy, 146 pounds and 5 feet 6 inches tall, but was reassured that my weight was the issue. Almost 2 years later, following the birth of my child, I started to continuously vomit. I couldn't keep food down, and if I wasn't throwing up food, it was just saliva and bile day and night. I was told it was new mom exhaustion and to try sucking on ice chips. Eventually, I vomited blood. I remembered watching a show that said red blood means an active bleed versus black blood, which means it has time to coagulate. So, I went to the emergency room with my television medical knowledge, and thankfully, they listened. They performed an endoscopy and discovered that not only did I have a type 3 hiatal hernia where my stomach was literally being pulled into my diaphragm, but it had been left untreated for so long that I had multiple ulcers in my stomach and esophagus, as well as a gastrointestinal obstruction which explained the vomiting. After the surgery to repair the hernia, I had a follow-up with my regular doctor, who looked at me with dead eyes and simply said, "Well, congratulations, you found a doctor to give you the attention you wanted." Needless to say, he's not my doctor anymore. Story 8. I believe your issues are psychosomatic. I have only been prescribing medications that I consider harmless to encourage you to believe they will be effective and help you improve. Story 9. I was run over by a car when I was 19. The wheels ran over my legs, and one tire was pressed against my knee for several minutes. It was very painful and traumatic. In the ambulance, they had to cut off my jeans. When the emergency room doctor came in to see me, the first thing he said was, "Now this is my favorite. When a beautiful woman comes in with her pants already cut off." Story 10. You will have to accept that you have stomach cancer. I did not have stomach cancer. She had not checked the tests she ordered before saying this. Story 11. You are experiencing side pain because you are overweight and wearing tight leggings. A week later, I went to the emergency room, believing my appendix had burst, but it turned out to be a ruptured ovarian cyst instead. Story 12. I'm an adult now, But this happened when I was a teenager suffering from migraines that I now know are caused by multiple sclerosis. It was said about me, in front of me, to my mother, "We can't find anything physically wrong with your daughter. But you know how teenage girls are. They'll do anything for attention." Sir, my nerves were being attacked by my own body. Story 13. I think you are just pretending, so you do not have to return to work. This was said to me by a psychiatrist after a failed suicide attempt that resulted in a 3-month medical leave from my job. I expressed to her that I was feeling a bit anxious about returning, as I had just completed my training when everything occurred, and I worried that I might not remember how everything functioned. Story 14. A patient expressed suicidal thoughts due to the pain he was experiencing. When I contacted the doctor to request a change in medication, he informed me to mind my own business, stating that the patient was already on the best medication. He insisted that I stop calling him and accused me of being disrespectful for advocating for my patient. Although I am typically calm and anxious, I raised my voice at that rude individual during the call. Story 15. I had a parent advocate comment on my child's name brand clothing because we were using Medicaid. I found the shirt on clearance a year prior and got 90% off, holding it until it fit him. Name brand clothes and free medical care. Huh? The child is 31 now, but I'm sure people still talk about the strong response I gave back. Story 16. We're ready for your procedure now, Ms. Brown. My name is not Brown. I was not there for any procedure. I never went back. I figure if they can mix up patients, they can mix up anything else. Story 17. The obstetrician gynecologist said, "I bet he's frustrated," referring to my husband, when I was 10 weeks postpartum and had mentioned that we hadn't had sexual intercourse yet because my vagina was still in a lot of pain. This was after experiencing an incredibly traumatic birth, both mentally and physically, which required extensive recovery. The same doctor who, a couple of weeks prior at my postpartum appointment, chose to chemically cauterize a wound in my vaginal canal without any numbing or pain relief. Story 18. The tests returned abnormal results, even for an adult, but I'm not going to diagnose anything because you're too young. For context, I missed my period for an entire year, and when it did return, it became a constant uncertainty, culminating in me bleeding for an entire month. I'm now on birth control and suspect it might have been polycystic ovary syndrome, but I can't get a definitive answer since that would require me to stop my birth control for a month to have my blood tested. Story 19. Prior to undergoing routine surgery, the conversation went as follows. How long have you lived in this city? I was born in this hospital. Looks like you've come full circle. I'm not dying. Story 20. I was 18, an aspiring musician when I developed tendinitis. I consulted several doctors, and one specialist told me that I probably had to give up music altogether. It was absolutely devastating. After a year of doing physical therapy on my own, I started playing again and have not had any problems since. The specialist was mistaken. Just because his painkillers and creams didn't work for me, he assumed I was a lost cause. Story 21. You are a working mother, so you may not have realized your son was sick. Lady, my son was brand new to daycare and caught every single illness repeatedly. It was a never-ending cycle of fussing and congestion. I definitely noticed. Story 22. 25 years ago, in a 10-minute meeting, a psychiatrist sternly told me without asking any questions, "You need to stop self-harming. It is socially unacceptable." I can't say that particular approach worked. Story 23. I was a child getting a strep test. The doctor told me that I would make someone really happy someday with my gag reflex. Story 24. I was informed over the phone that my husband had died. I was at the hospital, waiting in his room for him to return from a CT scan. Apparently, when they went to move him from his bed to the scan table, a blood clot affected his heart and he died. Instead of sending a colleague to his hospital room, she called the nurses' station and had them give me the phone. She then proceeded to tell me over the phone that he had died. It has been 3 years, and I still can't believe she did that. Story 25. You cannot do this. I knew you would struggle with this, said my night nurse when I was trying to push during labor but couldn't because I was suffering from an infection due to being in labor too long. I went into cardiac arrest and had to be resuscitated during an emergency cesarean section about 8 hours later. Story 26. My gynecologist referred me back to my primary care physician after she could not find a reason for my irregular periods. My primary care physician told me, "It is normal not to have a period for over a year. Look at me. I am a lesbian and have not gotten my period this month. It does not mean I am pregnant." I have since switched both doctors. My new gynecologist is very concerned about my irregular periods and is actively working with me to find a solution. Story 27. You're perfectly healthy. You just need to lose weight and get more sun. It was cancer. It turns out that thyroid cancer causes weight gain, and I was working as a gardener at the time, so the advice was useless. Runner-up. Nobody is going to take this seriously. I don't know anyone I can send this case to who isn't going to laugh and send it back. I have this one recorded. It was a spine disorder. Story 28. I experienced a tremor in 2022 that significantly impacted my life. I consulted 4 different doctors, underwent tests, scans, and lab work, and was referred to a neurologist, but he could not provide an explanation. I never received a general diagnosis. Now, at 25, I suffer from intermittent shaking, weakness, and decreased coordination on my left side. Story 29. Your spouse's stage for cancer has progressed, and the surgery we had planned today to remove the previously known metastases would not be a viable solution given the extent of the problem. At this point, we are shifting her to hospice care. Story 30. My primary care doctor, after my therapist recommended an autism assessment, said, "If you were autistic, you wouldn't be able to participate in this conversation right now." Story 31. It's because of menstruation. Next visit. It's obsessive-compulsive disorder. He was a gastroenterologist explaining why I had lost 25% of my body weight, vomited daily, and couldn't drink water for days at a time, resulting in emergency room visits for intravenous fluids. Story 32. Oh wait, I changed my answer. A psychiatrist was noting my sexual orientation in my file and said something like, "Oh, I wanted to ask you out." Story 33. I don't know why you're tired. You have a history of depression. It's just depression. It was cancer. Story 34. You shouldn't be here. My staff has better things to deal with than this. I was in the accident and emergency department after taking 30 paracetamol and then realizing I had made a mistake. I went back home, told my mother, and got to the hospital quickly enough for them to pump my stomach. There was no permanent damage. Nice guy. I hope he fell down a well. Story 35. I was diagnosed with a severe autoimmune disease about 15 years ago. When the doctor told me, he said, "The good news is it's not going to kill you right away. The bad news is you're going to wish you were dead every day until it does." He was right. Story 36. I'm going to include my dentist in this. When I was 16, I went to the dentist. After the dental hygienist completed the cleaning, he looked me in the eye and said, "You would be so much prettier if you got braces." I told my mom and dad, but they didn't believe me. I thought that was an extremely rude tactic to get referrals for braces. Story 37. After almost 8 years of increasingly severe alcoholism, the day finally came when I checked into a hospital for detox. The first night I was there, late at night, the head of the gastrointestinal department visited me alone. You could tell he had an important presence. He introduced himself and stated his position. He sat next to my bed, looked out the window and said, "If you leave here and have another drink, you will be dead in 2 weeks." He didn't look at me while he spoke. I clearly responded, "That sounds about right." He sat there for another minute in silence and then got up and left. That was it. I never saw him again. I am currently approaching 2 years of sobriety from alcohol. Story 38. I went to get diagnosed for adult attention deficit hyperactivity disorder. I found a doctor who was nearby and accepted my insurance. He was elderly and clearly did not support the concept of adult attention deficit hyperactivity disorder. He told me, "Have you thought about trying harder?" The next doctor was not much better. However, the one after that was great. He listened, conducted evaluations, and took my feedback regarding my response to medication seriously. Eventually, he had to stop accepting my insurance, and I had to find a new doctor. The one I have now is okay in a personal context, and their care is good. However, they are part of a clinic which involves a lot of red tape and communication is often restricted. Story 39. I took my father in for an endoscopy. The doctor came out and said she couldn't perform the procedure because of the mass in his throat, which was cancer. She delivered the update as if she were discussing the weather. It was surreal. I turned to my dad to confirm he heard the same thing I did. Unfortunately, it was stage 4 cancer. He died 6 months later. Her bedside manner was lacking. Story 40. In regard to hidradenitis suppurativa-related blackheads all over my chest, the response was, well, I could prescribe you something, but you mentioned your husband doesn't mind, and he's the only one that really matters, so we'll just leave it. Ma'am, what? Story 41. I've experienced worse situations, but this one always baffles me when I reflect on it. Hold on, let me get the doctor to confirm you're actually in labor, said in a snarky tone while she stared at the mountains on the contraction graph in triage. I could barely respond to her annoying questions. My mom wanted to confront her for that comment after she left the room. Story 42. Let me perform this procedure with local anesthesia, or you will go to the bottom of the list. You moved around too much because I was in pain, so I couldn't do it. Story 43. A psychiatrist once said to me, "You are not a kid anymore. Your childhood abuse is over. Why can't you just go to sleep and get over it?" I was having nightmares and trauma about going to sleep. When I told my therapist, she said she wanted to report him. Story 44. A friend's mother was dying, and when she asked about a timeline, the doctor told her that her mother shouldn't buy any green bananas. Yes, he was disciplined. Story 45. You have allergies. It was actually blood clots in one of my lungs, my groin, and the chamber of my heart. However, they wouldn't have discovered the heart failure. Story 46. My family physician has known me since I was a baby. He examined me when I was 18, while I was expressing feelings of suicidal ideation. I have never returned since that visit. Story 47. When I was 16, my gynecologist told me I had the prettiest labia she had ever seen. You are twice my age, my feet are in stirrups, and this room is stark white and ice cold. Doctor, this is not appropriate. Story 48. I experienced 3 mini strokes at age 14. I was advised to drink a Mountain Dew and lose weight. It turns out I have idiopathic intracranial hypertension and will struggle for the rest of my life. Story 49. I was crying in the exam room, discussing the significant weight gain and hair loss I was experiencing without understanding why these changes were happening to me. I was only 24. The doctor remained silent and then abruptly asked, "Do you need anything else from me?" Before walking out of the room, I sought a new doctor the moment I left that office. Story 50. My ears stick out a bit. I never really noticed until I visited an ear, nose, and throat specialist when I was around 8 years old for a tonsillectomy consultation. The doctor didn't think I needed to have my tonsils removed yet, so instead, he suggested that my family and I consider having my ears surgically pinned back. Story 51. I had to go to urgent care for signs of salmonella poisoning. The nurse who came in was a white woman who was very chatty. She had to take blood to check something. She was telling me a story about her tattoo artist. She was fine until she started using a racial slur. I did not respond with a laugh. She missed my vein the first time, and it hurt. She repeated the same sentence, including the racial slur, and I again did not react. She missed my vein a second time. She then started complaining that my veins were difficult to locate. Maybe instead of telling inappropriate stories, you could focus on taking my blood the right way and get me out of here. Story 52. How do you know it is the birth control pills making you sad? Have you considered that your relationship might just be bad? Thank you, doctor. It was indeed the birth control making me cry all the time. Story 53. You tend to be hypochondriacal. No, doctor, it was my gallbladder, and I had to endure several months of pain before you would refer me for an ultrasound. Story 54. It's unlikely that he will make it past 40. I was 8. My mother then slapped him in the face and yelled at him for saying that in front of me. I'm now 45 and still going strong. I had a bad case of staphylococcal scalded skin syndrome that permanently damaged my autoimmune system for those curious. Story 55. It's that time of year. Many colds are going around. I will write to you for some amoxicillin. The radiologist called me the next day to inform me that my lung had collapsed and to go to the emergency room as soon as possible. Story 56. Go home and wait it out. My family doctor of over 31 years said, while I was actively in diabetic ketoacidosis, which I did not realize at the time, I went to the emergency room 2 days later and was close to being in a coma. I was diagnosed with type 1 diabetes and had to stay in the hospital for 5.5 days in the intensive care unit under 24-hour care, followed by another 1.5 days in a regular room. When the discharge nurse signed me out, she had no idea I was a brand new diabetic. If I had just gone home and waited it out as my doctor suggested, my children would have been left at school for hours, and someone would have had to break in and potentially found me in a coma or dead. Story 57. I had a 105-degree fever for 3 days straight, couldn't turn my head, and had just been informed I would need a spinal tap, as my mother had complications from one. My heart rate went up to 280 beats per minute, and the monitor was alarming. The emergency room doctor asked, "Do you have anxiety or something? Why are you working yourself up?" I had meningitis and undiagnosed chronic tachycardia and arrhythmia. Story 58. When I went to the hospital in pain with Clostridioides difficile, because I was afraid I had vomited blood, I was already having routine bloody stools. My chart contained all my medical notes. It indicated that I had Clostridioides difficile and was working with 2 specialists on my treatment plan. I was also on a weight management plan, as it was hard to maintain my weight with my illness. Instead of giving me my lab results, which I knew were in because I had been notified, they held me for 4 hours in a state of fear. They refused to provide me with any pain relief as well. Then a clinician came in to speak with me. She advised that I didn't seem happy and proceeded to say, "I think you have done this to yourself." Apparently, they thought my well-documented weight loss was intentional and not the result of the life-threatening illness I had been fighting for a year and a half, while consuming nutritional shakes and being monitored by a doctor who had only good things to say about my treatment compliance. They seemed to believe that rather than Clostridioides difficile causing my vomiting, I was supposedly making myself throw up, which I would never do because it was extremely painful. My mom practically leapt out of her chair in frustration and sent that clinician out of the room. To add further insult, they refused to discharge me, even though there was no blood in my vomit. Apparently, they wanted to monitor me overnight. They denied me food despite my begging for dinner, as if the treatment for suspected anorexia was food deprivation. They still would not offer me any pain relief until the next morning, despite the Clostridioides difficile antibiotics causing pain on an empty stomach. This was absolutely incompetent, insulting, and inhumane treatment. I got over the chronic Clostridioides difficile infection but never got over that insult. Story 59. Whoa, did you gain? You were way up. I had COVID and lost 18 pounds during the previous year. 6 pounds of that loss came back over the holidays. 6, not 16, not 60. My doctor actually made a sound effect when she mentioned it. After that, she told me she noticed a weight gain and printed out a low-fat diet. I am 5 feet 6 inches tall and weigh 146 pounds. I weigh significantly less than my doctor or her office staff. I realize this is not a truly horrific situation, but what the actual fact. Story 60. You need to find Jesus and then you will be cured. While in the emergency room after experiencing multiple dislocations from a fall caused by vertigo, which was part of a 2-day migraine, the underlying condition is genetic. Story 61. For context, I have what some may consider an ethnic name. I saw a male obstetrician gynecologist for the first time. He mispronounced my name, and I corrected him. Later, he said, "Sorry for mispronouncing your name. Blame your parents." Then he laughed and walked off. Story 62. One doctor laughed at a physical abnormality I have, which I am quite self-conscious about. I never went back to her. Story 63. I had a negative experience with the nurses during my labor. They often shushed me for being too loud during my unmedicated labor and showed little compassion when I faced complications, such as losing a significant amount of blood, which affected my milk production. I felt ashamed for asking for a little formula to ensure my baby had something in his stomach. Story 64. My period was 10 days late, as I had a very reliable 28-day cycle. I couldn't get in to see my primary care physician, so I made an appointment with a male doctor because he was the only one available. He told me, "Sometimes periods are late. Come back if you miss two." I walked out after less than 5 minutes and was charged $240 for the visit. Fast forward a couple of years to the summer of 2020. I had an extreme sore throat and multiple negative COVID tests, so my retired registered nurse mom told me to get a strep test. I went to the nearest urgent care, which was in the same building as that clinic, and guess who my doctor was? He put me in an isolation room and refused to come in. He assessed me over the phone. After going through the whole process, he said, "It's unlikely you have strep," and refused to test me. This time, I stood my ground and said I wouldn't leave until he tested me. He came in, looked at my throat and said, "I'll test you, but you don't have strep. There are no white spots in your throat." A few minutes later, he called the room to tell me the test was positive. I have never gone back to that clinic or urgent care and now seek out care from female providers. Story 65. A smug pediatrician told me my infant toddler was lethargic. He curtly replied, "Don't say lethargic. It's listless." I went home and looked it up for synonyms. Story 66. At age 16, I saw an endocrinologist for a polycystic ovary syndrome workup. My main symptoms at that time were thick facial hair and weight gain. The doctor advised me to eat more salads and suggested seeing a therapist regarding the facial hair growth, which she considered a social issue. She ended the visit by saying that my symptoms would remain dormant if I weren't overweight. I was 5 feet 7 inches tall and weighed 130 pounds at the time. Her words made me cry. Story 67. I really struggled with my mental health when I was younger. I overdosed on pills and was vomiting uncontrollably when the paramedics arrived. I was sobbing and feeling very sick when one of the paramedics said, "That's what you get for trying to take your own life." Story 68. I had an urgent care doctor examine me for 5 minutes and say my chronic cough would go away if I had bariatric surgery. If he had taken the time to review my chart, he would have seen that I was already on a glucagon-like peptide 1 medication and was effectively losing weight while managing my blood sugar levels and A1C. My endocrinologist was horrified when I told her this. Story 69. That kidney stone is not big enough for medical intervention. Just keep drinking water and it will pass. I am sitting there in agony, weeping. Story 70. After telling me I had cancer, the doctor explained the treatment options. When I asked a question about the options, he responded incredulously, "Didn't you listen to what I just said?" I replied, "No. After you said cancer, I didn't hear anything." I insisted on a new doctor after that. Story 71. All the times doctors refused tests or treatment because they saw my depression diagnosis, saying, "That's just your depression." I had to suffer for years with a thyroid issue because of this. I felt uncomfortable at a gynecologist's appointment when the doctor referred to me as a clean girl during the examination. I was almost 30 and married, so it was very strange to be called a girl. It was really inappropriate on several levels. Story 72. I was in labor and pushing. The doctor yelled, "Get down! Are you trying to harm your baby?" It was 1980 at Lansdale Hospital. It was a horrible experience in many ways. Story 73. My pain wasn't recognized by many doctors for years. Finally, I had a black doctor who believed me and conducted tests. Turns out I have 2 chronic illnesses. Story 74. I don't believe you. The same doctor I overheard talking, who isn't tech-savvy at all, said, "I like telehealth because I can fit more people, which means I can bill more insurance in half the time." Story 75. 6 years ago, the results came back, and they were positive for cancer. It was the worst day of my wife's and my life. Story 76. You keep getting sinus infections and ear infections because of your weight. It couldn't possibly be related to the construction being done on the floor beneath where I work and the dust traveling through the air ducts. Story 77. He told my young girlfriend at the time that if she passed a piece of meat, it was our miscarriage. 17-year-old me was ready to punch him in the mouth. Story 78. When I was worried about the symptoms I was experiencing, he said, "Well, what do you want me to do about it?" I slammed the phone down and called Alex, another doctor. Story 79. Me to my primary care provider. I'm feeling depressed and anxious and would like a referral to a mental health professional. My primary care provider. The wait lists for them are several months long, so I'm not going to give you a referral. Here's a prescription for Zoloft. Also, you're overweight, so you should exercise more. He then spent the next 10 minutes looking up bodyweight workouts to show examples of what he thought I should do. At the time, I thought he was being inconsiderate. After a couple of weeks, I realized that if I had been actively suicidal, he could have essentially jeopardized my life with that appointment. Story 80. You shouldn't let finances dictate your health. I live in the United States. Are you covering the costs? Story 81. At 24, when I went in for hot flashes and vomiting, the doctor I saw in urgent care diagnosed me with polycystic ovary syndrome, which was correct. As he was leaving, he stated that I would never have children because polycystic ovary syndrome causes infertility. I received no treatment or care plan, only medication for the nausea and vomiting. I was left with a frightening diagnosis and the crushing news that I would never have children. Although polycystic ovary syndrome was a significant challenge for me and I fought infertility for several years, I eventually became pregnant and now have an amazing set of twins, a boy and a girl, whom I love dearly. If I could find him and express my dissatisfaction with his poor bedside manner and his alarming statement, I would. Story 82. Your arm hurts when you move it? Yes. Then don't move it. Well, thank you. I've never thought of that. This happened about 8 years ago. Story 83. I was anorexic at the time and had admitted on my check-in sheet that I had been purging. Given that I was actually obese, she didn't seem to think it was a bad thing and told me to keep up the good work. I am still overweight, but I got a different doctor and some help for the anorexia. Story 84. I was asking for permanent sterilization, and I was told that I couldn't because what if one day I got a husband and he wanted me to bear his children? Never mind that I'm child-free by choice and queer, and also an adult who can make my own choices. Story 85. I am a massage therapist who had a torn rotator cuff. When I asked the orthopedic doctor what I could do besides surgery, he said, "You can start a new career." I was 51 years old. Story 86. I had a prostate exam. Once the proctologist was finished, he tossed me a tissue box and told me to clean myself up. I asked if I should leave my copayment on the dresser on the way out. He did not seem amused, and I have not returned to him. Story 87. My doctor was checking emails to see when his car would be out of the shop while I was in an awkward position during my physical exam. I chose to get a female doctor immediately afterward. Story 88. I was 20 years old, in the middle of giving birth to my daughter during the transition stage. For those who don't know, that's when the baby's head is coming through, and whether you have an epidural or not, you can feel it. Anyway, it was my first baby, and I was not prepared to feel that even with an epidural. I screamed while pushing. The nurse who was helping hold my leg up stopped what she was doing, put her hand on my shoulder and said, "Stop screaming. You're going to scare the other mothers or people in the hall." I looked at her and exclaimed, "Are you kidding me right now?" But I couldn't dwell on that for too long because my daughter was out in the next breath. As I held her on my chest, I looked at my obstetrician while she was removing the rest of the afterbirth and told her to get that nurse out of my room. I don't know if anything happened to the nurse. I just knew I wanted her gone. 15 years later, my first birth experience is still overshadowed by that nurse telling me to quiet down while bringing a new life into the world. The reason she gave makes me even angrier. I might scare someone because I screamed? Forget her. Story 89. I had a severe experience with food poisoning, characterized by a foul odor and bloody diarrhea. It was clear that the food poisoning was from a restaurant where I dined alone. After the digital examination, the doctor informed me that I had blood in my rectum. I responded that I was experiencing bloody diarrhea, but she interrupted and asked if I was gay and terminally ill with AIDS. This made me pause, and I insisted that the blood was likely originating deeper in my gut, not my rectum. She dismissed my concerns, refused to collect a stool sample, and instead requested a urine sample, which sat on the counter during my entire 12-hour stay in urgent care. Later, while in the hospital bed, I mentioned that I had lost 25 pounds over the past month, struggled with anorexia, and had general nausea. I suggested that this information might help clarify my condition, but she shrugged it off and remarked that I was already overweight, viewing my weight loss as a blessing. I was taken aback, and she left the room before I could respond. I then confided in a nurse who quickly brought in another doctor. Unfortunately, the new doctor was worse. He ignored my concerns, stating that I had tachycardia. I explained that my elevated heart rate was likely due to pain, but he remarked that I appeared to be transgender and asked how long I had been on testosterone. 7 years, why? I replied. He claimed that was the most likely cause of my visit. Are you suggesting that my severe bloody diarrhea, anorexia, abdominal cramps, and weight loss are due to testosterone? Yes. I recommend discontinuing testosterone to revert to your original gender. I strive to be the best patient and avoid conflict, but I reached my breaking point. I shouted at the doctor for his transphobia and incompetence in failing to recognize that I was suffering from food poisoning. I demanded to leave. The nurses were incredibly kind and assisted me in discharging, though they requested a stool sample hours after the medication had quelled my symptoms. I took the sample kit home, and it ultimately tested positive for Shiga toxin-producing E. coli. I made sure to contact the customer complaint line for my healthcare provider, and the head doctor of the urgent care was extremely displeased with my experience. Story 90. I forgot what my complaint was, but it wasn't life-threatening. He said I should learn to deal with it because I was old. Story 91. When I was born, the doctor looked at my newborn lips and said to my parents, "She will make a man very happy someday." Story 92. My doctor wasn't available, so I saw his partner. I had a bladder infection and was in my late teens. I don't remember the context of the question, but he asked me if I had a lot of sexual activity. I said no, and he got angry and started yelling at me. I had never had sexual relations at that time, and he really made me uncomfortable. I don't know what his issue was, but I never went back. In fact, I quit the whole office. Story 93. You wouldn't have been a good mother anyway. What kind of mother doesn't know pregnancy symptoms? I was recovering from emergency surgery for an ectopic pregnancy that burst my fallopian tube and almost killed me. For those unaware, ectopic pregnancies have very different symptoms from regular pregnancies, and sometimes there are no symptoms at all. They are more commonly fatal than survived. I reported her because she did not deserve to be dealing with women when they are very vulnerable on the labor and delivery board. Story 94. When I was in labor and bent over the table receiving an epidural, the anesthesiologist let out a big sigh and said, "I always tell pregnant women not to gain weight in their backs, and they never listen." My husband just shook his head and whispered, "Don't. He has a really big needle." I was desperate, so I didn't say anything, and 16 years later, I still wish I had confronted that man. Story 95. Not me, but my mother had to get her medical records from her previous doctor when she moved and made the mistake of reading all of it. There was a visit summary that began with "Patient appears older than stated age." Story 96. Wasn't for me. This was for an ex-girlfriend of mine in college. What the medical professional meant was, "Are you sexually active?" What the medical professional said was, "Do you engage in sexual activity?" Story 97. I tried to explain the excruciating pain I had recently started experiencing during intercourse. My doctor said that painful intercourse is normal for 21-year-old women and suggested it was likely related to my partners or the positions I was choosing. He prescribed ibuprofen and sent me home. A year later, I underwent surgery and was diagnosed with endometriosis. Almost 5 years after that first experience, I have had 2 surgeries. My endometriosis has progressed to stage 2. I received a diagnosis of interstitial cystitis, and I am now exhibiting symptoms of both fibromyalgia and lupus. Trust your instincts and seek a second opinion. Painful intercourse is not normal. Story 98. This isn't as bad as others, but as a 17-year-old who was sexually assaulted and needed guidance and help, she said to me, "Take these antidepressants. No counselor will be able to understand what you're saying to them when you're sobbing at them." I had suicidal tendencies at the time, and my parents were unaware and not present. On the plus side, I saw a nurse recently and shared some trauma with her because I was unsure if my symptoms and stress were related. The first thing she did was ask if she could hug me. That hug will forever mean so much to me. Story 99. My wife's male gynecologist shook his head and made an inappropriate gesture instead of simply saying, "Abstain from intercourse for a few days." She is a 45-year-old married woman with 4 children. We understand what intercourse means. Story 100. There is nothing wrong with you. I told you to go home. This was from the surgeon who had nicked an accessory duct, and bile was filling my abdominal cavity. This was the second time I was at the emergency department, this time via ambulance because I could no longer walk. He also told me for the second time, "You're just constipated. You just can't handle pain." Story 101. You work only 40 hours a week, go to the gym, and stop complaining about your lack of energy. I was diagnosed with narcolepsy a year later. Story 102. It wasn't that bad. But when I went to my gynecologist for a routine checkup, I started undressing while she was still in the room. She was startled and insisted I wait until she left, as if she wasn't about to examine me. I suppose that since I work in surgery, where I have to change into scrubs in front of my colleagues and see nude patients frequently, I was too casual about it. Story 103. My primary care physician examined me for some infected stitches on my abdomen. He cleaned them up, prescribed medication, and advised me to stay out of contaminated water. I laughed and asked if I looked like the type of person who would go into contaminated water. He then said, "Well, no stock ponds or irrigation ditches." I just laughed and shook my head. You think they know you, and then they say something so surprising that you can't help but scratch your head. Story 104. Malnutrition never actually affects anyone. I have a history of eating disorders and hadn't been able to eat for a week because I was violently ill. I went to the emergency room and expressed my concern. I was told this, which was a relief because it gave me permission not to eat for the next 2 weeks. Story 105. During your examination for the injuries you suffered from sexual assault for the upcoming court case, this male student of mine will observe. Student: Wow, that hematoma pattern on the breast is fascinating. I'll need to examine it more closely. Different situation. I don't like seeing pubic hair. I don't encounter that often. Would you please cover it up? Here is some tape and tissue. Story 106. 13 years old. I was getting an ultrasound for severe abdominal pain when the technician exclaimed, "Wow, it looks like you were attacked by a bear." She was referring to my stretch marks. Story 107. If we check your cervix now, we will all be disappointed. After I had been in labor for 2 days following the rupture of my membranes, pleading for anyone to take me seriously. I was, in fact, 9.5 centimeters dilated. Story 108. I visited a doctor due to pain in my throat. Without conducting any tests or reviewing reports, he immediately said, "Your throat will swell, and your body too. If you get married and become pregnant, it will worsen and may never fully recover." I was shocked because I didn't even know what was wrong with me at that time. Also, can someone please let me know if my comment is visible? I'm new here and unsure how this works. I thought my comment was visible earlier, but now I'm confused about whether it still is. Story 109. It's probably just a urinary tract infection you let go too long, said an emergency medical technician to me in the back of her ambulance. She was frustrated I could not walk out of my upstairs apartment on my own because I kept passing out whenever I tried to sit up. It was, in fact, a ruptured ectopic pregnancy. I was bleeding internally. Story 110. My husband had some joint pain, so his doctor prescribed Celebrex, which is known to increase the risk of heart attack and stroke. He never asked my husband about his medical history, even though his father had a heart attack at a young age, and he never took his blood pressure. Fast forward a couple of months. My husband had a heart attack while running on the treadmill. He was 45 at the time and in great physical shape, having run a 5K race a couple of weeks before. While at the hospital, they determined that he was type 2 diabetic and had high blood pressure, which was all genetic. When he got out of the hospital, he had a follow-up with his doctor, who looked at his paperwork and said, "Well, no wonder you had a heart attack. You've got high blood pressure." I asked him when the last time was that he checked my husband's blood pressure. The doctor flipped through his chart and realized that he had never checked it, while my general practitioner checks mine every time I see her. Then he proceeded to shrug it off, saying, "Why would I check his blood pressure when he was complaining about joint pain?" I nearly jumped out of my chair. Thankfully, my amazing general practitioner referred my husband to a great doctor in her clinic who is very attentive and thorough. Story 111. An emergency room doctor once told a family member with terminal cancer that he was already dying and just wasting their time and resources. It wasn't even busy. There was only one other person there. Story 112. Not everyone is suited for every job. You should consider quitting yours and looking for a less stressful position. When I feel burnt out at work, I take a break and rest before seeking a new opportunity. I work as an art teacher at a K-12 school for children with special needs. I have been in my current role for 5 years. The doctor made that recommendation after I expressed my love for my job, the students, and my colleagues. Even though it can be very stressful, I always feel that I contribute positively to the world. Additionally, how could a teacher in the United States afford to take a few months off? That was the most out-of-touch comment I have ever heard. The second worst experience was with a doctor who failed to review my medications. He suggested that all my symptoms indicated a pituitary brain tumor and advised me to see a specialist. I spent 4 months in agonizing anxiety about the possibility of needing brain surgery, only to find out from the specialist that my symptoms were likely not due to a tumor but rather a side effect of the medications I was taking. I discontinued the medications, and all the side effects disappeared within 3 weeks. It was a horrible experience. Story 113. The doctor told me that period cramps hurt and discharged me from the emergency room without conducting any tests or having a meaningful conversation with me. I tried to explain that I wasn't on my period. 2 days later, I was rushed back with a ruptured appendix and nearly died of sepsis. The doctor attempted to claim credit for saving my life with the surgery. I made sure to assert loudly that it was his fault I almost died, as he had refused to take any action simply because I was a woman experiencing stomach pain. Story 114. After having an emergency cesarean section where the epidural and spinal pain block did not work, a nurse in recovery told me, "You are only in so much pain because you let yourself get worked up." I felt like I was still cut open and my insides were falling out. They administered morphine in my fore, and I did not even feel it. 10 years later, when I had a hysterectomy, I was never in that much pain. Story 115. A doctor thought I was making up a story about my illness. I would experience severe heart palpitations and wake up in a state of exhaustion with body pain from my head to my back. The doctor believed I was trying to obtain financial assistance from the government. Years later, after some electronic monitoring, it was discovered that I suffer from epileptic seizures in my sleep. The seizures often number nearly 90 per hour, with each one potentially being fatal. It's unfortunate that the doctor no longer works in this field, as I would love to give them a lecture. Trust me, it wouldn't be very polite. Story 116. An older male doctor told me that all my symptoms were due to my inability to have children. Although I have never wanted children, he insisted there was nothing wrong with me and that my symptoms were simply psychosomatic. He also claimed that the exercises I was doing were insufficient, despite having no prior information about my situation. The following day, I visited another doctor and was immediately diagnosed with tick bite fever. I received medication and felt better. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.